Thank you for joining us today. My name is Keith Larson, and I'm the president of the Louisville Forum. The Forum meets on the second Wednesday of every month at Vincenzo's Restaurant at noon. We are a nonprofit, nonpartisan, public issues group founded in 1984. We host debates and discussions of current and sometimes controversial public policy issues that affect the Louisville community. For more information on the Louisville Forum, please visit our website at louisvilleforum.org. Today's topic is COVID-19, the mandates debate. In the face of the surging Delta variant, breakthrough transmissions in the vaccinated, and a large population of children not yet able to receive the vaccine, our state continues to grapple with the role of protective mandates. Governor Beshear has said that if he had the ability to do it right now, we would have a masking order for when you are in public and indoors. In contrast, just yesterday, a House committee in Kentucky's General Assembly voted 15-5 to add a ban on statewide mask mandates to the bill that's working its way through the special session. So the questions remain. What role should the public and private sectors have in mandating these measures? Should masks be mandated? Should vaccines? Should we mandate social distancing and maximum capacities at restaurants and indoor events? If so, who is best equipped to issue these mandates? Also, perhaps just as important, what are the social impacts of mandates? How do they impact us, our children, our businesses, our communities? Joining us today to debate these issues, we have two speakers with very different perspectives and a moderator to help facilitate our questions. Our first speaker will be Dr. Chris Kolb. Dr. Kolb has served on the JCPS Board of Education since 2017, representing Crescent Hill, the Highlands, Bushel, Hikes Point, Mockingbird Valley, St. Matthews, and St. Regis Park. Since 2010, he's also worked with the community organization CLOUT, Citizens of Louisville Organized and United Together, twice serving as co-president and helping secure tens of millions of dollars for affordable housing and the implementation of restorative justice programs in JCPS. In 2009, he received his PhD from Johns Hopkins University, where he studied the relationship between race, racism, drug policy, mental illness, and urban redevelopment, and he's taught about these topics at Spalding for 13 years. Dr. Kolb is a proud JCPS graduate and JCPS parent. Dr. Kolb is here on my right. To my left, our second speaker will be Sarah Durand. Ms. Durand is the Director of Government Affairs at the Bluegrass Institute for Public Policy Solutions, which is a self-described think tank that seeks to offer free market solutions to the Commonwealth's greatest challenges. Ms. Durand started out majoring in biology at the University of Kentucky, went on to start a career in graphic and web design, and now works in public policy, which according to her was exactly how she planned it. Sarah has a wide range of campaign experience, from State House campaigns to serving as communications director on the first gubernatorial campaign of Governor Matt Bevin. After the election of Governor Bevin, Durand served as chief of staff for Kentucky First Lady Glenna Bevin. Today's moderator is Ryan Van Velzer with WFPL. We have a slight modification in our program. We thank Ryan for joining us today, but Ryland Barton had a last-minute conflict and was unable to join us. Ryan Van Velzer has worked in media for over a decade, including with the Associated Press, the Arizona Republic, and the Florida Sun-Sentinel. Over the last year, Van Velzer has reported on vaccine equity, interviewed the person with the Kentucky's first official case of COVID-19, and investigated the state's official count of COVID-19 deaths. So with that, I would like to welcome our speakers to make some opening remarks, and then Ryan is going to take over with our questions. Thank you.
Do you want me here?
Yeah.
Yep. Hello. First of all, thank you for having me to the Louisville Forum. As you heard, I'm Chris Kolb. I've been on the JCPS Board of Education since early 2017. So I want you to imagine the following scenario. You live on a quiet residential street. You have children. The neighborhood is filled with children who play outside regularly, as is healthy for children to do. When all of a sudden, for some unknown reason, cars automatically speed up to 90 miles an hour through your neighborhood. Now, you could take measures to protect your children. You could keep them inside. You could instruct them not to play in the street, as all parents do. However, children being children, you know that not all of them are going to listen all of the time, and that the fact that cars suddenly speed up to 90 miles an hour on your street is going to put them in danger. Now imagine that in addition to this, the government is considering forbidding you from reducing the speed of cars on your street and ensuring the safety of your children. This is an analogous situation to what we are experiencing right now with COVID-19. I dare say that all of us, if we lived on that quiet residential street and wanted our children to play outside, as healthy children do, we would take measures, any and all measures necessary to protect the lives and health of our children, even if that involved government stepping in and imposing something as crazy as a speed limit. So for many years, whether it's cigarette companies with their pro-smoking campaigns, some of you may remember when seatbelts were first mandated in the United States, some legislators were compared to Nazis for trying to do something as common sense as we now accept it as mandating seatbelts. All of these things, there's always a small minority of people throughout society that believe that their arcane notion of freedom is being impinged upon by common sense laws and mandates that promote the public good. It's fairly ironic that most of our state legislators and most people throughout our society now most people in our society see the value of STEM education, and our state legislators typically take great pains to prioritize STEM education within our public schools. However, those same scientists that our schools have produced, our best schools have produced throughout the United States, are now giving us the information that we need to keep everyone safe, including those who cannot yet be vaccinated, those with compromised immune systems, and those who, for health reasons, are at greater risk of having significant negative complications due to COVID, including death. For this reason, mandates are, contrary to what you might expect if you consume too much media, mandates are fairly popular in the United States, with a strong majority of people favoring mask mandates in particular in all public places, not only in schools. These mandates are most popular among African American families who, as we've seen throughout the pandemic, have suffered more negative consequences than other groups of people. And let's be clear that COVID is a significant threat to our health, whether or not we live through the experience of having it. This includes for children. All science regarding COVID is, of course, subject to revision as new data comes out, but the best information we now have regarding complications from COVID indicates that over 60% of children will experience symptoms of COVID that last over 6 months at least. This includes 20% with fatigue, 13% with shortness of breath, 13% with impaired concentration, and 11% with memory problems. In addition, COVID can lead to as much as a 7-point drop in IQ. And for comparison, lead poisoning leads to roughly a 2% drop in IQ. So we are talking about long-term, potentially lifelong, debilitating conditions for tens of thousands of people throughout the country, including for many of our children. Again, I submit to you that if there were simple, proven methods to safeguard the health and well-being of our children while allowing them to do things like remain in school and learn in person, that as a parent like me, you might be in favor of those things. Just this morning, and I'll wrap up with this, the public health, sorry, I forget her exact title, Dr. Sarah Moyer from the city of Louisville stated We are losing the future of Louisville and in the process stressing out our healthcare heroes, many of which are reaching a breaking point. And I would submit that if we're willing to do this, if we're willing to sacrifice children and other people to death and illness, lifelong disability, then perhaps we should examine our notions of freedom and ask ourselves which freedoms we are really for preserving and which we are not. I would submit that preserving the health and safety of children should be near or at the top of the list of freedoms worth preserving, and that every freedom entails some sacrifice. Thank you.
Thank you. I appreciate the opportunity to be here. I've been in the audience a few times, but this is the first time that I've been invited to speak, so I appreciate the invitation. I am not here as a person who's anti-mask or as an anti-vaxxer. I am here as a person who's pro-liberty. I believe that your medical decisions are yours and yours alone, and they are personal and sacred. Your medical decisions should never be political. It is not the role of the CDC or the Jefferson County School Board or any government entity to make those medical decisions for you and rule over the health of you and your family. It is their role to provide information for you to make the best decision based on your unique circumstances and individual needs. The amount of sickness and death surrounding COVID saddens me, like I'm sure it saddens all of us. Yet we have to keep in mind that for years, people in our Commonwealth have died of heart disease. More people in our Commonwealth have died of heart disease every year than have died from COVID in 18 months. This is an example where people exercise their right to ignore the advice of their doctor and the CDC and make decisions for themselves. They may choose to eat fast food, even though the medical community tells you it will eventually kill you. Historically, more people die of heart disease every day in this country than die of COVID daily. But we don't outlaw cheeseburgers, thank goodness. We don't mandate exercise. And we don't publicly shame people who are overweight because they're putting themselves at greater risk of developing and potentially dying from heart disease, the way that we do the unmasked and unvaccinated. We allow them to make their own decisions, and they must suffer the consequences of their personal decisions. If you want to wear a mask or get vaccinated, do it. If you don't, don't. We all have reasons for our choices, and those reasons should be respected. It may surprise you to know that I am fully vaccinated. I almost did not get vaccinated because I'm worried about how new this drug is. But also I wanted to stand in solidarity for medical freedom with people who have every right to say that they do not want to be forced or bullied to put a drug into their body. And then my husband said, yes, let's do it. Let's stand up for medical freedom. I'll stand with you, but can you please get vaccinated so you aren't doing it from a ventilator? So I made that decision with him, for him, and even though that is the decision that we made, if you're worried about the newness of this drug and the science, I support whatever decision that you make. The FDA, they pull drugs that they've approved often enough to be worried. We don't know the long-term consequences in short-term studies. How often do you see an ad that says, if you've taken X drug and have suffered these consequences, you might be entitled to a settlement? So if you want to stay part of the control group of this experiment and make sure that this drug proves that it's not going to turn us all into zombies, I get it, and I support your decision. I hope you're wrong for my sake, but I do support your decision. I'm not really here to argue about the efficacy of mask wearing, although I'm happy to talk about how there is science on both sides. If you want to hear about the 109 studies on long-term mask wearing going all the way back to 2004 that shows that it has serious psychological and medical consequences, or if you want to hear about the most recent study from our very own University of Louisville that was released just 2 weeks ago that found no correlation at all between mask mandate and use and the reduce in spreading COVID, I'm happy to go there. If you want to talk about vaccine deaths and the over 600,000 adverse effects that have been reported, I'm happy to go there. But mostly I'm here to say that I respect your right as a free person to make your own medical decisions, and I hope you'll respect mine. I'm much more worried about the precedent for freedom it sets if we start allowing the government and corporations and big pharma to force us to put drugs in our body that we don't want. If they can do that, then they can do anything. If you're scared of me, get vaccinated. If I'm scared of you, I can and did get vaccinated. No matter how much the media and government try to keep us hysterical and pit us against each other for our personal health decisions, I would never trade your liberty for my security. In a free society, you do you. Thank you.
Thank you both, and thank you to Louisville Forum for having me today. Again, my name is Ryan Van Velzer. I will be the moderator today. I think Keith covered this well, but I want to start by just kind of doing a little bit of table setting here. We're in the fourth wave of this virus. Cases are as high as they've ever been. We have a large number of hospitals with ICUs that are at or near capacity. And the people showing up in those people filling up the hospitals are largely unvaccinated. 85 to 90% of these cases and deaths are in the unvaccinated population. It's weird to think that we've been here before, but we have been here before. I was looking back at this case, Jacobson versus Massachusetts. It was the first Supreme Court decision on vaccinations. It happened back in 1905, and it was about smallpox vaccinations. And Chief Justice Marshall Harlan was the person who actually made the majority decision in that case. He's from Boyle County, Kentucky. He decided 7-2 in that case to uphold vaccination laws, to allow mandatory vaccinations for smallpox in that case. And what was really interesting to me about that case is that they were arguing the same things that we are still arguing today, which is, what are the limits of state power and personal liberty? I want to bring up this one point. Although they did ultimately decide on allowing mandatory vaccinations, the idea was that that is within the state's power to make that decision, or whatever body is imbued with the state's power. However, he also said this: the power of the state, whether exercised by the legislature or by a local body acting under its own authority, may be exerted in such circumstances or by regulations so arbitrary and oppressive in particular cases as to justify the interference of the courts to prevent wrong and oppression. So they're looking for that same balance that we are looking for today. And I think that's a good place to start this debate. How do you protect human health and safety while respecting people's personal liberties? And with that in mind, I want to ask both of you, I'll start with Sarah, what is the best path forward that both protects personal liberties while protecting public health and safety?
Sure. Can you hear me? I'm a soft talker. Well, I'll start by saying that smallpox and COVID are very different. You could mandate a COVID vaccine and you're not going to eradicate it, just like you could mandate the flu vaccine and you're not going to eradicate it. And my understanding from reading, scientists' opinions, it's because smallpox cannot be carried by animals. So, unlike the flu and COVID. So unless you're going to mandate me vaccinating my dogs and all the squirrels in my yard, it is not going to go away. It is going to be exactly like the flu. It's going to continue to have different variants. It's going to continue to mutate. And we're gonna deal with this the same way that we deal with the flu. We can start with it now. We can start mandating vaccines. It's not going to go away. It's going to end up being something that we're stuck with for a very, very long time. Government cannot solve all of our problems. They cannot solve the flu. Science can't solve all of our problems. They've been trying to cure the flu. It hasn't happened, and it's not going to happen for this either. This is the nature of airborne viruses that can be carried by animals as well. So I believe that the way that we protect public health is by giving people choices. We tell them the best practices, the best things they can do, the same way we do with the flu. If you're worried about the flu, you can get vaccinated. You can wear a mask. You can stay away from crowds. Those are all your choices. And thousands of people die from the flu every single year, even who make those choices. You know, there's so many different strains of the flu at this point that they have to guess what they put in the vaccine because we don't know which ones are going to be the worst ones, which is why sometimes it's more effective than other times. That's not something government can fix. Government cannot fix this virus. We're stuck with it. We're going to live with it. And we just need to let people make the best decisions for themselves.
So, first, we could have eradicated COVID if we had taken, I think Sarah's right that at this point, COVID is here to stay. It didn't have to be that way. We could have eradicated it if we had taken the necessary steps early on. We did not do that, so it is unfortunately here to stay. And this is something that we often hear, that COVID is here to stay. We've got to adjust our lives for its presence. But what we're doing, if we do not allow governmental entities that are elected, in a democratic process, if we do not allow those entities to regulate the new reality that we are all living in, what we're doing is failing to adapt to that new reality. School boards, thankfully, in the state of Kentucky, are elected entities. And if there are folks in the city that don't like the job I'm doing, I know there's a lot of them out there because I hear from them, every 4 years they have a choice whether or not they can rehire me to do that job. So paradoxically, the very anti-regulatory attitude that comes out of the state often in terms of doing things like banning mandates is precisely the sort of very concerning infringement of the freedom of the voters of Louisville that I would hope that Sarah and everybody else would be against. Eating a cheeseburger does not threaten my health. If you want to smoke a cigarette in the comfort of your own home or backyard, you are free to do that. But there is a reason that you're not free to smoke a cigarette in here. And there's a reason that you're not free to smoke a cigarette and blow the smoke in my face. And if people were walking around smoking cigarettes and blowing it in people's faces, yeah, I could wear a mask to protect myself, and I certainly would if that was a common practice. But that's not going to protect me from 100% of the smoke. Just like wearing a mask and getting vaccinated and avoiding crowds is not going to protect you from getting COVID because of someone else's reckless, irresponsible decisions.
I think that brings up a good point, and on the heels of that, let me ask you, Sarah, how do you protect the most vulnerable in our society? How do you protect people who are immunocompromised, elderly people, people with disabilities, who might be infected by somebody who is just trying to live out their personal liberty and might inadvertently get somebody sick?
Well, let me just say that, first of all, it's not your responsibility to keep me from getting sick. If I want to get sick, I can make choices for myself, such as being vaccinated. Secondly, on the second day of school, my JCPS asthmatic daughter came home having trouble breathing because she was forced to wear a mask while running laps in PE class. She had to have a breathing treatment. This is a child who's been hospitalized multiple times for asthma. This is a child whose doctor recommends that she not wear a mask because COVID still, even with the Delta variant, represents less of a risk to her than her breathing in her own carbon dioxide for 8 hours a day, all day long. The JCPS school board doesn't know that. They don't know my daughter, and even if they did, they could never love her or want what's best for her more than I can, which makes me the person who's in the best position to make the decision as to whether or not she should be masking herself and if that's safe and healthy for her. I'm the one that deals with her coming home unable to breathe. I'm the one that has to say, what do I do? Do I send her back to school tomorrow, knowing that they're going to try to force her to wear a mask again, and then it's going to hurt her health? Those are decisions that I have to make, that I should be making, and that I shouldn't have to worry about some board that's been elected to help us educate our kids, making those health decisions for me and my family. So I would argue that the way that I would protect people is I would let people make the best decisions based on their unique circumstances and their individual needs.
I want to ask the opposite question to Dr. Kolb. Bashir has said repeatedly that the right policy is often the one that is the most protective, that he can get the most people to follow. So on the heels of that, what does that look like in Kentucky right now? What is the most protective policy that people will actually abide by?
Yeah, I mean, I actually would disagree with the governor about that. I don't think that anybody really knows, if it's the rule that leads to the behavior, or if people aren't going to do it anyway, that we should not have the rule in the first place. But if that were the case, then the logical end of that is that we would get rid of all laws in our society, which may be the reality that some people want to live with, but certainly isn't the one that I want to live with. Just to address a few points, and I'll just say I'm not going to spend my time today trying to rebut the misinformation that you're hearing up here. There is a lot of misinformation. I'll just leave it at that. We'd be here all day if I took the time to do that. Yeah, every parent does know, the situation of their child much better than the Jefferson County Board of Education, which is why any sensible regulation comes with exceptions, which the Jefferson County Board of Education was careful to put in there. So in this case, I think, honestly, some folks might be tempted to interpret the differences of opinion that you're hearing as partisan divisions. I assure you that while there is a partisan element, I have just as much contempt for Democratic lawmakers that don't do what I consider would be helpful as I do for Republican lawmakers. And frankly, I haven't thought, I don't think the governor's done a very good job. He's certainly under some pressure, from a strong supermajority in the legislature. But at the end of the day, it's all of our responsibilities as elected officials to take the steps that we know are going to not only keep people safe, but allow children to do things like remain in school in person. And if we were to get rid of these things, the reality is that very soon schools would have to close to in-person instruction. We'd be back where we were last year. And as the parent of a now fifth grader, there are few things in the world that I want less than to have to be home with my fifth grader again, because last year was pretty difficult, as many of you also probably know.
So for the first time in this pandemic, the legislature is behind the wheel, not Governor Bashir. And Governor Bashir is in a situation where he has to compromise with state lawmakers. Yesterday, he brought up this idea. He talked about working with lawmakers on a compromise, looking at a metric for things like mask wearing. If cases reach a certain threshold, maybe an automatic mask mandate goes into effect for a certain county. And once it goes underneath that threshold, then the local government has the authority to make their own decisions about mask mandates. Is that a compromise, Sarah, that you find agreeable or workable? And the same question to you, Chris, afterwards.
Well, I'd say that medicine is not an exact science, and we're always learning new things, and what we know now is not what we knew 18 months ago. And because of that, we should be able to, instead of having these sweeping, broad, overreaching mandates for everybody in the entire district and that sort of thing, we should be able to take more targeted approaches. If there's an outbreak in a classroom, then the local school board should have the ability to say, okay, those kids are going to do NTI for 2 weeks or something like that. So I do believe that there needs to be some flexibility in some of these things. But the more we know, the more targeted those things should be able to be, and the less oppressive they should be on infringing on people's rights when, that classroom may not be affecting my child's classroom.
So would you support that kind of compromise that Bashir is talking about on a county basis or on a school district basis?
Well, I think that you mean for masking?
Yeah, so if there are a certain number of cases in a given community, then a mask mandate goes into effect until it goes below that threshold.
Well, I think that one of the issues you're going to run into is that the Kentucky Constitution says that no law can be absolute or arbitrary. If my child has to wear a mask to school by law, and then that my child doesn't have to wear a mask to the grocery store, that's an arbitrary law. That's an unconstitutional, arbitrary law. So I think that's one of the areas that you're going to run into if you try to make certain exceptions. I don't believe that masking is something that should be mandated ever by anyone other than the individual or the parent of a student. There are too many studies that show that, let me just give you an example. Just a few weeks ago, the chief of pediatrics at Tufts Children's Hospital came out and said masking students all day is akin to child abuse. He mentioned all kinds of terrible things that it does to them. It's isolating. It causes anxiety, depression, higher levels of carbon dioxide. It can cause confusion. There's so many problems with masking that I think the best case scenario for that is for each of us to look at the science and make the best decision there. I am more worried about my child's asthma than I am about COVID. Therefore, the decision I would make is to not mask my child. I have 2 other children. It may make more sense for me to mask them.
Okay, Chris, how about you on the governor's proposed compromise?
I mean, as with anything like that, the devil would be in the details, and at what the specific levels different things kicked in. And speaking personally, I have a pretty low amount of confidence in state government's ability to follow the best science around that. So my strong preference would be for it to be left totally up to local boards of education, and that would mean that I would suspect that many parts of the state would probably not have any mask mandates or anything like that. But, one of the things that you're seeing is the number of school districts throughout the state that have had to close their doors to in-person instruction because they did not begin the school year with mask mandates. So there are, logical consequences, as it were, to not following the best science. And I think it makes most sense to leave those sorts of decisions up to the elected officials that are closest to parents, and in this case, that's your local school board member.
Sure.
So one of the problems we've seen with the mandates that have come out so far from the executive cabinet is that they've lacked due process. They levy penalties with no appeals process. If you say that I'm guilty in my county of not wearing a mask, and I say I'm innocent, who do I go to? Do I go to Jason Glass, who's head of the Board of Education, and appeal to him? Do I request a trial by jury of my peers? If there's no due process, the 14th Amendment of the United States Constitution says that you cannot levy penalties without due process. So as long as we're making these mask mandates without any sort of appeals process, I'm never going to be able to support that because it's not supported constitutionally through the U.S. Constitution, the Kentucky Constitution, or Kentucky law.
Chris, do you have a brief response to that?
No.
Okay. All right. We're going to go with audience questions now. This is for Chris. Why are we relying on the long-term damages of COVID to children on something so new? How can we have long-term data on something so brand new?
Yeah, I mean, we can. I mean, it's a fantastic question. I mean, this is a completely novel situation that we're in, and there are no certainties. Even in the best cases, science does not give us absolute certainties. Even in the best cases, you can find some science on both sides of a question, whether it's the health effects of smoking or climate change or anything like that. You can always find a small minority of people that are pushing a largely scientifically discredited view. We are trying to make decisions based on the best available information. It's entirely possible that we're overreacting, but the tricky thing about exercising caution is that if you were correct to exercise caution, you will have prevented the very negative consequences that would have shown that you were correct to be cautious. Whereas if you are cautious, and you prevent those consequences, it looks like an overreaction because the bad thing didn't happen, when in reality it was the measures you imposed that made that happen. So yeah, I mean, we're doing the best we can with the available information.
All right, I've got another question here for Sarah. JCPS requires several vaccines for students to attend school. How is the COVID vaccine any different?
Well, for one, the COVID vaccine is different because it's brand new. We don't know the long-term consequences. Not only is it a brand new vaccine, it's a brand new type of vaccine. These mRNA vaccines, this is the first time they've ever been mass produced on large scale. I mean, and this is something that's it's not affecting your DNA, but some people feel like it's, you know, when you say it's part of your genetic makeup, that it could be affecting your DNA. The other argument I would make is, you know, there are a lot of people who have been anti-vaccine. And have chosen to homeschool their children or put their children in private school, even for these vaccines that have been around for years and years, you know, decades. And I think that right now, I'm seeing their point more than I ever saw it before about these mandated vaccines. Now that COVID is supposed to be, you know, the COVID vaccines may be put into category with these other vaccines that have been around for a long time. And unfortunately, the people who really suffer, the families who really suffer from these mandated vaccines are like the single working mom who's working 2 jobs who can't keep her child home from school to homeschool or who can't afford private school. You know, if they mandate a COVID vaccine, I can make those choices. My husband and I can make those tough choices to put our child in private school. But if you don't have the means to do it, you have no options. And that's just, I think that this is one of the examples of why we need more school choice. If we're going to mandate vaccines, parents need to have options if they don't feel comfortable putting that drug in their child's body.
I will say that the vaccine does not affect your DNA. Moving on, Sarah, you spoke about listening to the science. Norton Hospitals recently mandated vaccines for employees. Should schools in Kentucky follow suit?
No.
Easy enough. And for Chris, what would be the metric to not wear masks? We will always have cases of COVID.
Yeah, it's again, a very good question. I mean, one of the most important things in my mind is, regardless of whether or not there's a vaccine mandate, are vaccines available for everyone that is in what we all recognize as a risky situation? And as of right now, those vaccines are not available. You know, if you are 11 years old or younger, we have tens of thousands of kids in our JCPS in very close proximity to one another who are unvaccinated because of that. So that, you know, that would be, I think once everybody has the option to be vaccinated in sufficient time to be vaccinated, I think that does change the conversation around these sorts of things. But even having said that, you know, this is something we constantly have to reevaluate. New variants emerge very frequently. You know, Delta, we think, is more capable of breaking through a vaccination than you're, of course, still very protected. But we don't know if future variants are going to be able to break through that vaccination and do much more harm than Delta seems able to do. So, you know, I can't give a scripted answer or a rigorous answer because the reality is literally changing, you know, every day.
This is a question for both of you. Is it a decision for yourself if it is a transmissible disease that you received, you know, that you received from somebody else and could kill somebody else? Well, yeah, we'll just go with that.
Got the gist of it, yeah.
Yeah, that's the gist of it. Oh, sorry, yeah, Sarah, to start.
Well, people are carrying around transmissible diseases all the time that we don't know. I mean, look at the flu. If you catch the flu, we're not having this hysterical conversation where people are screaming about how you shouldn't have gone out in public or you should wear a mask. I think that the issue that we're seeing here is everyone, you know, as usual, the loudest voices in the room don't represent the majority of rationally thinking human beings. And so we're treating people as second-class citizens for not doing certain things in case they might be carrying something that they don't know that they're carrying. We don't do that in any other situation. Okay, once again, government cannot solve all of our problems. Mandates cannot solve all of our problems. Locking us down, masking us up, not allowing us to freely breathe, or forcing us to put drugs in our body aren't going to solve this. There is no way to solve the flu at this point in time, or COVID.
I have to ask, you know, what is, if it's everyone's personal responsibility, then the ultimate outcome of that, as we've seen throughout this pandemic in states across the country, is when there are less mandates in place and people are allowed to do what they want, make their own personal decisions, the virus spreads more freely. And more people die as a result. Are you willing to accept that more people will die in the name of personal liberty?
Well, I would say several things to that. First of all, I don't think that necessarily that because people aren't wearing masks, there's science on both sides. Again, the University of Louisville came out with a study 2 weeks ago that said that masking, they found zero association between masking and between the spread or prevention of COVID. So when, I love how when people say, well, there's science on both sides, they go, oh, well, those people are crazy. No, you're just not reading the other side. You're not willing to look and open your eyes to the other side. The other thing that I would say, and I can't say it enough, government can't solve all of our problems. The president can't cure a virus. The government can't cure the flu. These are the realities and facts of life. We are going to deal with viruses our entire lives. But imagine if when the AIDS virus first surfaced and we didn't know how it was spread and people were afraid to touch something if somebody with AIDS, imagine if we treated them the way that we treat people who don't want to mask or vaccinate. It's just the way that the conversation is going in this country, it makes it very difficult, I feel like, to save lives. Because you have people like me who say, I would give you the shirt off my back until you mandate me to do it. I did not want to get vaccinated because you're going to mandate me to do it, and I believe in freedom. Think of all the lives that have been lost to give us the freedoms that we have, the millions of people who've died around the country so that we could have a free country, so that we could freely breathe, freely show our faces, not have to put drugs in our body. James Madison said that the greatest property that we have is our conscience. And that's what pulls you in the direction to do what you believe is the right thing. And he believed that the worst thing you could ever do to infringe on someone's rights is to stop them from doing what they believe is the right thing to do. If taking a drug is not the right thing for you, that should be your choice.
Chris, would you like to respond?
Well, I'll just say that first, I'm old enough to remember that we did treat people with AIDS that way in the 1980s and 90s, thanks largely to the free market president, Ronald Reagan. But I'll say, I don't know anybody that does think that government can solve all of our problems. And if they do, then I would certainly disagree with them as well. The reality is that if we follow the logical thinking that we're hearing, then we would have a society with absolutely no laws whatsoever. Every law, every regulation imposes some infringement on your personal freedom. I don't want to live in that type of society. I don't want to live in anarchy and chaos, and I don't think that most people do. And finally, I do want to say that, I was hopeful that this would not happen today, but, if you look at places like Florida, especially, you see that the very cynical, response to the COVID crisis is, by the governor in particular, is little more than a very thinly veiled attack on public education in an effort to strip funding and support and student counts in public education. So I was hopeful that we would stay focused on COVID today, but when you hear things like school choice injected into a debate where it has nothing to do with it, I worry that ideological extremism, is infecting even supposedly rational debate around COVID.
Can I respond to that?
Briefly.
So collective groups don't have rights. Individuals have rights. Those are rights that have been given to you by God, not by man, not by government. So when we start talking about rights, we have to keep that in mind. The greatest rights that you have are over your own person and your own body.
Chris, would you like to briefly?
Well, and I just wonder if you don't believe in God. I happen to believe in God, but if you don't believe in God, then does that mean you don't have any rights? That seems to be what you're saying.
This is for Sarah. We had several questions about masking and its efficacy. Why should hospitals be overpopulated with anti-vaccine patients or unvaccinated patients. If you don't wear a mask, are you not potentially harming my 6-year-old child or your 6-year-old child?
Well, you can mask your 6-year-old child if that's what you'd like to do. That's your option. Just like I have my individual liberty not to. Let me also add that the way that the CDC calculates unvaccinated patients, if you've had the one vaccine and you go into the hospital, you're unvaccinated. If you've had the vaccine less than 14 days and you die or are sick, you are unvaccinated. The way that they calculate those numbers is artificially inflating the number of sick patients who are unvaccinated.
Could I say something on that? Well, I just want to say, some of you may have seen the very tragic story of a U.S. veteran who died recently in Texas of a very treatable condition because he could not get hospital care due to the influx of largely unvaccinated COVID patients in Texas. So he now no longer has the freedom to be alive, to be there for his spouse and children or his community because other people wanted to not be vaccinated.
All right, another question here from you all. When vaccination percentages are 27% for the Black community and minority populations have been subjected to numerous overreaching public health initiatives which cause reasonable fears, now will we ensure we don't create discriminatory practices with mandates? I'll start with Sarah. How will we ensure we don't create discriminatory practices with mandates?
We don't have mandates.
Yeah, I mean, unfortunately, there's a long history of very well-deserved skepticism of things like vaccine mandates among many African Americans and other minorities because of truly reprehensible things that have happened in the past. But however, you also see the strongest support for things like vaccine and mask mandates among African Americans.
At this point in the pandemic, we're seeing an interesting shift where largely the control over protective measures has been in the hands of the executive branch. For the first time, we're seeing it in the hands of the legislative branch. Sarah, do you see that as more representative of the public, and would you be more amenable to decisions passed by the legislative branch versus a smaller number of people in the executive branch?
Well, I appreciate that the legislature has taken some steps in the last session in order to be more of a co-equal branch of government with the executive. It certainly was frustrating to have the governor be allowed to make these broad, wide-sweeping mandates without really any voice from the people. The legislators are closer to the people. They are our representatives. They are a lot easier to voice your opinion to than the governor would be. I also appreciate that they're very much right now focused on local control and allowing there to be some local control. My issue with the local control is that constitutionally, both United States Constitution and the Kentucky Constitution, I don't see how they have the right to give local government the ability to mandate things for my health and my body. But I think they're at least moving in the right direction, whereas the governor was in completely the wrong direction.
Chris, same question to you.
Yeah, I mean, even closer than the legislature to the people is local school board. So I certainly agree with that principle. One of the really frustrating aspects of this from a school board member perspective is that the state legislature, the current one, strong majority, supermajority of Republicans, they love to impose regulations on education. I mean, every year. Local school boards have to negotiate a complex and far-reaching and ever-expanding web of regulations that are imposed by the largely Republican state legislature. So, it's not a question of, unfortunately, if you look at what actually happens, it's not a philosophical question of regulation or not. It's a question of which regulations people are in favor of proposing, at least at the state legislature level. I very much believe that Sarah has consistent ideological principles. Yeah, that's just a really, really frustrating thing to hear what amounts to, pretty sheer hypocrisy coming out of the state legislature about about not imposing regulations.
In a similar vein, we have time for just a few more questions here. Well, actually, let's just round it out with this last question for each of you. Words have more weight now than it seems like they ever did in my career as a journalist. It's really unbelievable to me that we could live in this time where our words matter so much. I mean, it can at times literally be the difference between life and death in communicating all of this information. And at the same time, we live in this world now where there is so much misinformation and disinformation, and people are isolated in their own worldviews every time they get on the internet, Twitter, Instagram, what have you, Facebook. How do we come together and try and find common ground, common facts at a time like this? Chris, why don't you start?
Yeah, I mean, I wish I knew. I mean, I think that history has shown us that a lot of things that are very contentious when they are first discussed become accepted as just the way things are and become not as divisive. That's certainly not true of everything. But many things become less divisive as time goes on and people get used to it, and it's just a part of everyday life. So I think, I'm usually not a very hopeful person, but I'm hopeful that the current rhetoric will tamp down, and we will eventually, see a coming together on all sides around the best things to do to balance all of these things that we're talking about. But there's no guarantee that that's going to happen. I mean, the reality is that there are many folks and institutions in our society that have a vested interest in stoking divisions and in keeping those divisions alive. The news media, of course, is one of them. So, I don't know. I mean, I'm continuing to work on the issue every day with my colleagues on the board and read the science in hopes that we eventually, will come to some broad social agreement about what's best for everybody, especially kids in schools.
Sarah, with just a couple minutes left.
Yeah, well, I agree with Chris that I hope that we can tone some of the rhetoric down. So often we have a common enemy. I mean, we have a common enemy right now in COVID. We disagree sometimes on how to deal with that common enemy. But if we tone down the rhetoric and stop making judgments for people's choices and allow people to make their own choices, then maybe we can create an environment where someone can have a honest conversation with his or her doctor about what's best, or honest conversations with each other.
And I'll just finish out here by saying, first thanking Louisville Forum for holding discussions like this, because, I mean, at the very least, this is the best of a democratic society that even if we can't agree on all of the facts, we can come up together, have these discussions, and make informed decisions based on those discussions. So thank you to Louisville Forum, and thank you both, Chris, Sarah, for participating in this discussion.
Great, and thank you, Ryan, for helping us out today with getting some of your questions answered. I apologize. We were sifting through about 30, 40 questions over there, and I apologize that we didn't get to everybody's, but it was great to have this conversation. Thank you, everybody, for coming out today. We appreciate it. We will be sending out an email blast in the next couple of weeks about our topic for October, but as always, we'll be meeting on the second Wednesday in October here at Vincenzo's. Thank you very much. Have a great day.
Thanks.